Hello everyone. Keep your face always towards the sunshine, and lights will fall behind you all week Monroe. And it's always a pleasure to be in the sunny Monaco and the radiant AMWC. There is no disclosure. I will also start with vulvar lichen sclerosus. Can collagen treat vulvar lichen sclerosus? I will present a female patient, 36 years old, with a biopsy-proven active vulvar lichen sclerosus. I will say a few things about this disease, even though the previous speaker mentioned many things. It's a chronic inflammatory dermatosis characterized by ivory white plaques and patches with glistening surface, commonly affecting the anogenital region. It may cause substantial discomfort due to the intractable itching and soreness, while thinning and shrinkage of the genital area make coitus urination and defecation painful. Advanced disease has on one hand a considerable impact on the quality of life, on the other hand it's associated with an increased risk of vulvar squamous cell carcinoma. Is there a definite cure for this disease? The answer is no. There is no definite cure for this disease, and nor is there a comprehensive treatment to cover all patients. Current guidelines aim to treat patients with ultrapotent topical corticosteroids, and the patients should be regularly evaluated for skin atrophy or any malignant change. Let's go back to my patient. She was suffering from porcelain white atrophic confluent plaques with fragile surface, and she had pruritus, soreness, erosions, discomfort, and dyspareunia. She used twice daily for 3 weeks an ultrapotent topical corticosteroid, clobetazole propionate. After the 3 weeks, there was a slight clinical improvement. There were no erosions, and there was a minor symptomatic relief. There was a bit less pruritus. At that point, I had in front of me a young woman who was desperate. Her whole life had changed from minor things, she couldn't put on her tight clothes, to more important things, the relationship with her husband changed. So I suggested, and she agreed, to try an innovative regenerative treatment based on heterologous type 1 collagen. Heterologous type 1 collagen has been used for 30 years in dermatology, angiology, vascular surgery in a form of a lyophilized collagen patch to treat scars, open wounds, bed sores, and it was applied directly on the lesion. For the last years now, a powder formulation with the same active ingredient is being widely used in aesthetic medicine and anti-aging treatments as it produces optimal conditions to restore connective tissue. How does this work? Which is its mechanism of action? The powder formulation, in order to be injected, gets dissolved in normal saline. Once it gets dissolved, it gets hydrolyzed in tripeptides and amino acids. Tripeptides act as dermal growth factors to the old fibroblasts, promote cellular mitotic activity, and we have the production of young fibroblasts. The amino acids are being used by the young fibroblasts to produce collagen type 3. On the other hand, tripeptides block the action of metalloproteinase. Now, what did we do to the patient? We used 100 milligrams heterologous type 1 collagen powder dissolved in 4.5 ml normal saline plus 0.5 ml lidocaine, and we injected to the affected area. We injected 0.1 ml per point intradermal or directly subdermal at approximately 1 centimeter intervals. We used a topical anesthetic cream before the injections, and 32 G needle 4 millimeters. Let's see how we started. This is how we started. The patient received 4 treatments, 15 days apart. This is before the first treatment. This is before the second treatment. we see already an improvement. This is before the third treatment and before the fourth treatment. Now, at a quick overview, when the patient came for the second treatment, she was already happy because she reported that she was free of symptoms and she stopped using the corticosteroid cream. And the fact is that she hasn't used it since. Now there were no side effects and there was minimal to moderate pain. Now, after 3 months, we started a maintenance treatment. All this period she was fine, free of symptoms. This is 2 months after when she came for the second time for the maintenance treatment. And this is 7 months after. All this time she is being treated with heterologous type 1 collagen, and she's really glad that this procedure was tried on her. Now, one more thing is the mother of the patient was suffering from the same disease, and she was coming along with her daughter while she was doing the injectable treatment. And the mother kept on saying, this is for young women, I'm fine with my cream. But at the point, her lesions started to expand. And so she wanted to try the injectable procedure with heterologous type 1 collagen. This is before the first treatment. This is before the second treatment. We already see the improvement. And this is before the third treatment. And this is 6 years after. She's being treated only with heterologous type 1 collagen. Now, heterologous type 1 collagen is a successful treatment method for vulvar lichen sclerosus. It has excellent results, it's safe, hypoallergenic, has no side effects. It can be performed in any office setting under local anesthesia, can be combined with other treatments, and it can reduce the duration of the therapy, can be used as a monotherapy. And we can imagine if heterologous type 1 collagen can treat vulvar lichen sclerosus with good results, how remarkable the results will be if we use it for rejuvenation of the genital area. This is the suggested protocol. We use 100 milligrams heterologous type 1 collagen dissolved in 4.5 ml normal saline plus 0.5 ml lidocaine, and we inject 2.5 ml per vulvar side, 0.1 ml per point with 1 centimeter intervals. I have to say that we also tried the heterologous type 1 collagen in male genital lichen sclerosus, and the results were really good. And we have published 2 papers, one for the males and one for the females. Now, given the fact that the heterologous type 1 collagen is being used for many years in many medical fields, and given the results obtained with heterologous type 1 collagen in vulvar lichen sclerosus and also in rejuvenation of the genital area, we can consider heterologous type 1 collagen a first choice treatment for skin regeneration. And aesthetic medicine deals with beauty, and beauty always starts with a smile. A smiling face is a beautiful face. So I can assure you that heterologous type 1 collagen made my patients smile. Thank you.
We start with the questions.